Hello everyone, this is the Farm Doctor and today we are going to talk about stroke management. So let's talk about these three cases. The first one is a 65-year-old man, sudden hemiplegia arrives 2 hours after onset. What would you do? So hemiplegia is like the sudden paralysis on one side. The next case is a 72-year-old woman with AFib develops ischemic stroke. How would you treat this patient? Note that these two patients are different and the treatment would be different for both patients due to the age, gender, and the time of onset as well, with other history. Case 3. 58-year-old man with warfarin had sudden intracranial bleeding. What would you do? So in this case, we have intracranial bleeding unlike the ischemic stroke. So let's get started so that we can know how we can come back and answer these cases. What is stroke? Stroke is a sudden neurological deficit due to impaired blood flow to the brain. So ischemic stroke accounts for 85% when we have an obstruction due to a thrombus, embolus, or atherosclerotic plaque that gets stuck in the blood vessel, causing an ischemic stroke. While in hemorrhagic stroke, it accounts for 15% and usually there's a rupture in the blood vessel. This leads to bleeding in the tissue or in the subarachnoid space, like in our case 3. There's sudden bleeding, hence hemorrhagic stroke. Why is this important? Because stroke is the leading cause of disability and the second leading cause of death worldwide. Globally, we have 60% of our stroke patients develop permanent disabilities and they experience limitations in mobility, vision, speech, and swallowing function. In part 2, we'll discuss more about the pathophysiology, the treatment, and prevention.